Demystifying back surgery, a simple guide to lumbar discectomy and its risks. Hello there! In this whiteboard animation brought to you by Spinemathema and consultant neurosurgeon Mr. Sadek, we're going to delve into a surgical procedure that's commonly performed, known as lumbar discectomy. Let's first understand some basics. Our spinal column is a stack of small bones or vertebrae. In between these vertebrae are soft, cushiony discs that absorb shocks and facilitate movement. Occasionally, these discs may bulge or even rupture due to a variety of reasons, such as strain, injury, or age. When this happens, the disc can start to press onto the nerves in the spine, leading to significant discomfort or pain. A lumbar discectomy is a surgical procedure performed to remove the portion of the disc that is causing the unwanted pressure and pain. It aims to alleviate the symptoms and improve the patient's quality of life. During this procedure, the surgeon first makes a small incision in your lower back. Utilizing specialized instruments and guided by imaging, they meticulously navigate to the problematic disc. The segment causing nerve pressure is then carefully excised. Despite its high success rate, lumbar discectomy is not without potential risks. These include infection, which occurs in 1 to 3% of cases, nerve damage seen in 1 to 2% of cases, and a recurrence of the disc herniation in 10 to 15% of cases. Post-surgery, many patients experience immediate symptom relief. However, full recovery, including return to regular activities, may take a few weeks to months, depending on individual health factors and the rehabilitation process. As with any surgical procedure, it's important to have a thorough discussion with your healthcare provider. They can help you understand if lumbar discectomy is the best course of action for your specific situation. Thank you for watching. We hope this has been informative. Remember, gaining knowledge is the first step to making the most informed decisions about your health. Don't forget to like, share, and subscribe for more insightful videos from Spinemathema.com and Mr. Sadek.